So I'd rather overlap more than less. Just don't overlap your negative electrodes. Okay? And you can do 2 passes if you want. Very simple to do. So let's try this right here. Let me know how this feels. You ready? One. Now I'm going to do all my electrodes one direction. When I do the second pass, I simply turn it and do the same direction. Okay? So stretch the skin a little bit, and how did that feel?
Ow.
Oh?
Yes.
Tell me how that felt.
That's nice.
I better go high. Where did you put your cream? Down to here? Down to where? I'll go a little higher. Let me know how it feels.
Ow.
That's too. Is that too strong for you? Is that too strong?
No, that's ow. No.
Okay, so if the patient doesn't like that, turn it down. Turn it down. Remember, we're in Fraxel territory here, and Fraxel can be painful. So we're going to turn this down to 10 millijoules per pin. Now, she's with the company, so if she's saying, "Oh," you can tell that she's not trying to sell you, right? Because otherwise she would pee her pants and not say a word.
Should we sterilize after use?
Okay, you ready? Let's do another one over here.
Should we sterilize?
Now we're down to 10. Is that acceptable? Now sometimes you'll feel a little contraction of the facial muscle. Remember, this has deep sublation. That RF is going very deep in the dermis, and it tickles some of the superficial facial nerves, so you get a little contraction. Don't worry about that. It's not going to injure the facial nerve. That's from the sublated effect. Now, you might wait a bit. You see that nice erythema, a little bit of edema. If you had some magnifying loops on, you would see tiny little holes. But this is more like a Fraxel treatment than it is a CO2 treatment. Okay. Okay, young lady. Nice and easy. Overlapping 50%. Nice and easy. Now, she said numbing cream on for a good half an hour. We did BLT, benzocaine, lidocaine, tetracaine. Now, once we get off the jawline, it's a little less sensitive. Some people are contracting on involuntarily. It's not that they're having discomfort. They just have contraction. So if you get up around the eye and you see an involuntary contraction of orbicularis oculi, don't freak out, because it's just involuntary. Now she's getting a very nice edema, a nice erythema. What you're seeing is the sublative RF effect. She's getting a nice, now this will be is a very nice treatment for acne scarring. You're doing good. I'll go slow around the eye, nice and easy. Nice and easy. Now this type of lady that I guarantee jumped when she got IPL. She's a very sensitive kind of gal. Because you can come by and just do 10 millijoules on the back of your hand. You know, it's not overly strong. She's sensitive. Okay?
About how long does that derm?
It takes about 2 hours, 2 to 3 hours. So, but they can put some makeup on right away and go right back to work. Now the nice thing about active pilosebaceous acne, the RF will shrink some of the sebaceous glands. So it's a good treatment if they do have active acne. Yeah. Okay, so that's a very nice sort of result that you would expect with the treatment. And this is something you would delegate into the hands of your esthetician. I'd start out with Fractora Firm, do all the tightening, then take out Fractora and do the ablation. So I go deep to superficial. Okay, but that's a very nice response. She's going to get a very nice response. Now, let's say we want to do a second pass. I'd come back. I'd do the other side first, see how much she reacts there. Let's go to the other side. Turn this way. You're doing beautifully, young lady. Excellent. Okay, a little test spot here. I'm up and down with my electrodes. Overlapping 50%. Now, as you're coming off the skin, you can feel it. So watch the skin stick. See that? See the skin stick? That's ablating right down into the dermis. You want to feel that stickiness.
Doctor, what is your pressure like?
I'm just, okay, so I'm not going and pushing. I'm on the skin and then a very light pressure. See, I'm deforming the skin about 1 millimeter or 2 as I'm stamping the pins on the skin. But I'm not pushing super hard.
Do the pins move?
The pins do not move. They're static. Static. It's not like intracell where you get that pop, pop. These are just static. You're stamping. You're doing great, young lady. There'll be some sensitive areas depending on where your facial nerves lie. Now, sometimes with the E matrix, the whole face would contract. Like the whole face would go. And you can sometimes get that with any RF technology. With this one, you get that when you're up around 40 millijoules per pin and higher. You get some contraction of the facial musculature. But by then, it doesn't matter because you're doing tumescent anesthesia when you're 40, 45 millijoules per pin. Very simple technique to do. Very good for Asian skin because we're relying less on ablation and more on sublation. I'm right over her acne scars here. Take your time. She's having sensitivity. Take your time. You know what else helps a lot? Do you have a Zimmer cooler? A little cooler so you can hold in your other hand and cool the skin while you're doing it. That helps a lot. Very nice ablation on her. She's getting a nice effect. Very, very simple treatment. Very simple treatment. A little down here on your chinny chin chin. Now, what about the lips? Can you treat the lips? Yes, of course. Now, if they're prone to, let's say, cold sores, I get them on some Valtrex. In fact, I don't believe patients because they usually lie, right? So most patients, I will give 500 milligrams right there in the clinic, even a gram right there, and then give them a prescription, tell them to take it for a week. So make sure you get some Valtrex, okay, for this week. Now, on the upper lip, a nice cooler really helps. Zzz, you're cooling, 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 and then 1, 2, 3, you can fire. And so cooler helps nicely with this particular product. But she'll see some lightening of her pigment. She'll get some texture improvements in her acne scars. If she did a treatment like this once a month for 3 sessions, I would recommend 5 to her. But if she did 3, she'd get a very nice improvement in her overall texture and tightening. Okay, now a little bit on the nose is very good for pilosebaceous units on the nose. The overall redness will go down on your patient. So you know when you do CO2 or you're seeing a CO2 patient back and they're red and you know, oh my God, I have to do 5 IPLs on her just to get the redness out. This will get the overall redness down because it's getting some of the vessels in the skin. Now, how about the bridge of the nose? You simply lift the skin up so that you can get right in contact with it like that. Excellent, young lady. You've done great. That was easy, wasn't it? Now, what about lower lids? You don't need ocular protection in the lid because it's RF. And you can get right up to the ciliary lash line. So I turn my electrode sideways so I can get that electrode right up to the lash line, get right up onto that orbital rim, right where that wrinkle is. If you have a patient with wrinkles, 1, 2, 3. 1, 2, 3. And 1, 2, 3. To the other side. Now, is it the shock that's kind of shocking you? What bugs you?
Yes.
1, 2, 3. And 1, 2, 3. Have you ever done Fraxel? Have you ever done anything? What have you done on your face? What treatments? Have you done photofacial? So you've done that.
E-Matrix.
Which one? E-Matrix, okay. So how does this, how does this compare with your E-Matrix? Just relax. How does this compare with your